Hey team, this is Alison Moe, PA with United Digestive, a division of Atlanta Gastroenterology Associates. Today we're going to be going over and reviewing our liver findings and what they look like with our Madrigal liver model. I use this a lot in the office with patients because liver stuff is very difficult for people to see, even if you show them on a TV or a diagram that's in your exam room. So I find that when I'm talking to patients about starting them on therapy or letting them know where they fall in the fibrosis diagnosis, if I show them this model and let them feel each area, it helps with people understanding their disease state. So this is a full anatomical equivalent size model. It's cut into different sections, and the sections are both for visualization and for feel to show the level of fibrosis and the differences in what that feels like. So our first section, and this is what I give to my patients all the time, is I show them this is what a normal liver looks like. There's no fibrosis. There's no fatty liver. It's very soft to the touch and normal in contour, meaning nice and smooth on the outside. And then I show them fatty liver or F1 fibrosis, which still feels pretty similar to the initial normal liver and still has a relatively smooth consistency, but you can feel that the liver starts to get a little bit tough to squeeze. And this is where we're still in our inflammatory state, but we do not have any scarring in the liver. And then next I show them what F2 fibrosis looks like, which is where we start to have some of the spread of ballooning or changes in the actual structure of the cells of the liver. And in this stage, I find it important to give them this one and also go back to giving them the normal liver. Because if you're just giving them, until we get to the really firm fibrotic stages, if we give them just this stage, they think that this feels exactly the same as what the normal liver feels like. So I try to give them both of these simultaneously, or even let them keep the normal liver section in their hands the whole time as we go through the stages of fibrosis. And then, of course, our F3 fibrosis, which is where we really feel a big difference in the fibrosis and the firmness of the liver on palpation when we feel it. And then I really show here the patients of where the nodularity starts to show up on the model, which is very different from our smooth contour that we see with F1 and obviously with a normal liver. And although you can't really see it great maybe on video, you can, when you're looking at the liver model, see the difference between the starting of the nodular on the outside of it not being smooth like it is with a normal liver. And then next we have F4 or fibrosis, a full cirrhosis. And this is where obviously you can see the nodular contour on the outside. That would be similar to what we would see on some cross-sectional imaging or even on an ultrasound. And this is where I tell the patients, we have essentially cirrhosis of the liver. And then this last part of the model is cirrhosis of the liver with a hepatocellular carcinoma. So showing patients the liver cancer that they're at risk of getting if they continue to allow their metabolic-associated fatty liver disease continue to advance without intervention or therapy. So I think this is super helpful. If I have a patient that I'm reviewing their FibroScan or going over some of their non-invasive testing, I will pull this from my office to bring it into the room just to be able to show the patients. I kind of even show them like on my belly, like where this is, because it does anatomically match and it's appropriate to show them how big of an organ this is in their abdomen. And then while I go over their FibroScan and I go over their CAP scores or I go over their KPA scores or their Fib4 ELF testing, etc., I'll have them hold that normal part in their hand and then continue to give them each one of these sections just so that they can see the comparative difference. And of course, review with them that even though there are no symptoms of these early or middle stages of fibrosis, that what we don't want is for them to get to this advanced stage before, we start to see any decompensation. So super helpful. I think it's a great learning tool. A lot of people learn things visually instead of you just telling them about it. And since there's a lot of lack of symptoms with fibrosis or fatty liver, I think this is super helpful. I hope you guys have a great rest of the day. And if you have any further questions, feel free to reach out.